name is Lilly Stairs, and I am the head of patient advocacy at Clara Health. We are a company working to connect patients to clinical trials, and I'm also a patient myself. I am living with psoriatic arthritis and Crohn's disease. So at the age of 7, I was actually diagnosed with psoriasis. And psoriasis, mine was guttate, so it looked like chickenpox all over my body. And I was never told that that was an autoimmune disease. And I was also never told that 30% of people who are diagnosed with psoriasis will actually get psoriatic arthritis. So fast forward many years to when I turned 19, I was actually just, over the course of a summer, started to develop this underlying pain. And then one day I woke up and I literally just couldn't even move. So I was to the point where my mom had to dress me, she had to feed me. My whole body was paralyzed with pain. And it was at that point that I was diagnosed with psoriatic arthritis. And when I say pain, I mean I was put on a whole slew of narcotics and none of them did anything to help. So then finally at the age of, oh nope, still 19. So 2 autoimmune diseases weren't enough. So we had to add a third, and I was diagnosed with Crohn's disease 6 months after my psoriatic arthritis diagnosis. And that actually happened after I was in and out of the ER 3 times in one weekend. The doctors in the ER unfortunately didn't believe me that I was dealing with pain, and I would try to swallow water. I was in agonizing pain just swallowing water. It was absolutely awful. And so they thought that I was just trying to get access to pain meds. And so finally, the third time I was admitted, the third time I went to the ER, I was finally admitted, was in the hospital for a week. They ran a series of tests. Finally, they did a capsule endoscopy, and that's when they found bleeding ulcers in my small intestine, and I was diagnosed with Crohn's disease. So about 75% of the patients who are living with autoimmune diseases are actually women. And there are studies that show women are unfortunately not always believed by physicians that they are in pain. They are put in the situation where they need to prove their pain, and there are countless studies on this. So this has happened for so many patients living with autoimmune diseases, and it's something that really happened with me as well. So I had gone in and out of the ER 3 times with this agonizing pain I had unlike anything I had ever experienced. And they didn't believe me. They thought I just wanted morphine, that I was trying to get access to drugs, or that I was all in my head. And here I was, this very happy, otherwise healthy 19-year-old who wanted to be back in school, wanted to be back in college, didn't want to be in this hospital bed, but here I was. And I was afraid because nobody believed me, and I didn't know that I was going to get the treatment I needed. And so we need to see a change in mindset, a shift in mindset from some of these physicians out of the idea that, and acknowledging these biases that the healthcare system has against women. I have been incredibly fortunate when it comes to access in my experience as a patient. I have had insurance throughout the entire time, and they've actually been really wonderful about covering the medicines that my doctors prescribe, which is refreshing because with the work that I do, oftentimes I hear about how patients do not get access to the medicine their physician wants them to be on. Right now we have a problem with insurers playing doctor and saying, well, I know your physician wants you on this medicine, but we've cut a deal with this person, and so we need to give you this medication first, or you have to go through step therapy before you can get to the medication that you need. And so I have been fortunate in that every single medicine my physician has prescribed, I've been able to get access to it. Step therapy is when you are forced, this happens a lot to autoimmune disease patients, when you are forced to go through a series of medications before you can get to the one that your physician wants you to be on. So it makes you try some of these medications, maybe they're less expensive, maybe they are less potent than some of the other medications, but they are making you go through it because the insurance company wants to make sure that they're not spending extra money. What I will tell you is that unfortunately many autoimmune disease patients, their disease progresses because they don't get access to the right medication. So let's say I'm a patient who's just been diagnosed with Crohn's disease and my doctor wants to put me on what's called a biologic. but they're not gonna let me go on the biologic. My disease is very severe, but the insurance company says, nope, she has to try this drug, and this drug before she can get access to that biologic, the biologic that my doctor wants me to be on. And so during that time that I have to try and fail X, Y, and Z, go through these steps, my disease progresses. And some people, their disease progresses so much that they need surgery. And so in the end, has the insurance company saved any money? No, because now they have had to pay for a surgery. So step therapy is bananas to me. It doesn't make any sense. It's intended to save money, and it's not. So we need to reevaluate what that looks like. Maybe that's worked for other diseases in the past, but with these complex chronic illnesses, it's not okay. Non-medical switching is when insurers are playing doctor. So let's say my doctor wants me on a medication. You have biologics, which are these entire class of medications. They tend to treat patients with autoimmune diseases. And insurance companies view them as being all in one class, and therefore they're all the same, so they're interchangeable. The problem is that if my doctor wants me on a drug that targets, they all have different mechanisms of action, every biologic. So if my doctor wants me on a drug that targets IL-12 and 26, the interleukin 12 and 26, that's a specific mechanism of action. Sometimes the insurance company could turn around and say, well, no, we want to put her on a different biologic that's an anti-TNF inhibitor. But anti-TNF inhibitors don't work for me. So they're just saying, oh, they're all biologics, they're all in the same class, it's fine. This is our preferred drug, she needs to be on that. So then the insurance company comes back and they literally change the prescription that the doctor prescribed to the patient. So now insurance company is getting involved in the decision between the doctor and the patient. How is this legal? It's a great question. I don't know. I actually sat on a commission in Massachusetts this past year where we did some research on how dangerous this practice can be, how it actually can add cost to the Commonwealth. The report hasn't been released yet, but I'm hoping it's going to be released soon. I am also hoping that there is going to be a bill that is put into place to prevent this from happening. We're seeing step therapy bills in place. We're just starting to see non-medical switching bills come out. And they are detrimental to patients, truly. Oh, it's difficult. It is so difficult to live with chronic illnesses when you are a child, a teen, a young adult, into adulthood. From the time I remember when I was 7 and had the psoriasis, I was so afraid for other people to see it at school because I didn't want them to think they were going to get it or that it was contagious, and so I always felt very uncomfortable wearing like a t-shirt. It was embarrassing for me. And then you move on to when here I am at age 19 with arthritis, and you think only old people get arthritis, or that's the mentality that we have in society, when in reality there are actually so many young people who are living with arthritis. And so it kind of gives you a complex, right? And then you have to deal with, okay, now dating's in the picture, and how do I talk to somebody about the fact that I have these chronic illnesses, and are they going to, will anybody ever love me? I mean, these are the things that run through your head when you are first diagnosed, and that's why I think it's so important that we have advocates out there, and we have some amazing chronic illness advocates in the community who talk about what it's like to live with chronic illness and give other people hope that it's going to be okay. I've always been a person who has fought for the underdog. I think it's been a part of my nature. And from the time that I was in the hospital bed, so now let's say I was in the hospital bed for Crohn's disease. This was my 3rd autoimmune diagnosis, and I had never heard the word autoimmune before. I never heard the word autoimmune before, and I was now living with 3 autoimmune diseases. How is that possible? And there are 50 million Americans who are living with an autoimmune disease. For point of reference, that's about twice as many as cancer. And we all know somebody living with cancer, right? So there's twice as many people with autoimmune diseases, but we're not talking about them. And so I remember being in a hospital bed and saying, this isn't right. This is something that I'm living with, and I had no idea. I'd never even heard about it before. And so I felt compelled from that moment in time that this was my reason for being. This is something that I needed to do to help others. And so from that moment, I actually left the hospital, and actually while I was in the hospital, I kind of started cooking up ideas for ways that I could help starting to raise awareness, and then began the journey through the healing process. And through my journey into remission, I spent time, I got on Twitter and I started talking to fellow advocates, and I said, I want to blog about my experiences. I want other young women and young people who are diagnosed with these diseases to know it's going to be okay. And so I knew from the moment I was in the hospital bed, it was really my calling that I needed to help others. It's hard to say advantages and disadvantages when it comes to physical versus invisible. And it's interesting because I've had conversations with other patients who have a physical disability, and we've talked about the fact that, yeah, okay, I have a physical disability, somebody has a physical disability, and so people automatically understand, right? They maybe have empathy for you right away. But also, people with physical disabilities get frustrated because they don't want people to treat them differently necessarily. They don't want, this woman was telling me once, she said, oh, people will like talk to me like I'm a baby. And I said, I'm okay, I'm in a wheelchair, but I'm fine. But there is an automatic empathy there. Invisible illness, it's tough. People don't get it. They don't understand that when I am standing there and I look okay and I put makeup on in the morning, I might be exhausted. I might be to the point where I can barely even talk, I'm so tired. I can barely take a shower, I'm so tired, but nobody can see that, and they think I look fine, so they think everything's okay. You know, I'll never forget, I was on the MBTA, the local Boston public transit, and I was coming back from work and I was in so much pain. Like my body was just, my arthritis was flaring. And I was sitting and an older woman got onto the train and people were looking at me like I should stand up to give her my seat. And I was like, these people probably don't even know I am in worse condition than this older elderly lady standing here. But nobody saw that. People just see what they think is a healthy 19-year-old. So in terms of society, these preconceived notions and these assumptions that people have about diseases can be really frustrating. So when people have found out that I have Crohn's disease, they're like, oh, isn't that a disease where you run to the bathroom a lot? And I'm like, no, that's not actually what my experience has been. I actually had bleeding ulcers in my small intestine, and that was really the only disease the only symptom I presented with. Now, that wasn't a great symptom to be living with, but it was a very different experience. And then when people say, oh, I thought only old people get arthritis. Okay, yeah, I know, it's a little, people joke you're like an old lady, and it's okay, you know, but it can be a little frustrating. And so trying to be open and understanding that all of these diseases present very differently for each person, and being respectful of what somebody is going through. Also not jumping to the conclusion that like just because I look okay means that I am capable of doing everything else that somebody else is doing. Sometimes I'm gonna be so exhausted that I can't go out to dinner because I physically don't even want to hold myself up. I just want to lie down and sleep. If I had a magic wand, oh God, do we have like 24 hours for me to just talk and tell you all the things I want fixed? I will tell you one of the most devastating things I have seen, and thank God it hasn't happened to me, but one of the worst things I have seen from my work at Clara and work with patients and advocates is the financial devastation that chronic illness can put on patients and families. I have watched and heard the stories of patients who they have jobs, they're contributing members of society, they have families, and then all of a sudden they are diagnosed with a chronic illness and their insurance doesn't cover the medicine they need, or you know, they have so many medical bills that they just can't afford to keep up and they go bankrupt. They lose everything, and they were doing everything right. They had jobs, they were contributing to society, and they lost it all. And that is not fair. What? Because they were dealt this, they got this disease. They didn't ask for this disease. They didn't ask to be diagnosed with a chronic illness. They didn't do anything to prompt them being diagnosed with a chronic illness. But here they are, and this is the hand they've been dealt, and they are not being supported by our current system as it stands. And I have a huge problem with that. I knew I wanted to dedicate both my personal and professional life to patient advocacy from the time that I was in the hospital bed. And I discovered through some of the work that I had done in healthcare already that the patient voice was missing in a lot of what we were doing. And it's really interesting because I think the biotech industry has actually done a decent job bringing the patient voice in over the past 10 or so years, but we're not seeing that on some of the health tech and digital health side of things. And so it was really exciting when Clara Health brought me on as their head of patient advocacy and one of the founding members of the team. And it was refreshing to see that they wanted the patient voice in there from the beginning. And so through this, I have had the opportunity to both champion the patient voice internally and externally. And what is most important to me that we are doing is that we are empowering patients with the knowledge that they have the power in their healthcare journey, right? They own it, they make their treatment decisions, they decide how their care is managed. It is up to you, and it is up to you to own that and to feel empowered to own that. And I think we lack that just because we talked about this, the societal constructs that are in place. When you look at the doctor-patient relationship, patients need to know that, hey, this is my body. This is my choice, what I do with it. And I have every right to seek a second opinion. I have every right to challenge this diagnosis. I have every right to challenge the treatment options. That's really important. And so for me to have the platform to be able to do that with Clara Health has been amazing. And to work on the Patients Have Power campaign and empower other patients with this knowledge, I couldn't ask for a better job. So Patients Have Power means to me that patients own their journey. They own their journey. And you know what else Patients Have Power means to me? It means all of those advocates that I have the opportunity to work with every day. I work with so many patients who inspire me to be more empowered in my healthcare journey, who are inspiring others every day to be empowered in their healthcare journey. We as a community are powerful. We collectively as patients have power, and that's what it means to me. Okay, people can get in touch with me on my website, lillystairs.com. Lilly with 2 L's, L-I-L-L-Y, stairs like going up and down. Also, I'm on Twitter. You can find me at Lilly Stairs, Instagram at Lily Rose Stairs, and I also work with Clara Health, and so you can come check us out. We're all over Twitter and Instagram as well. You can check out our website, clarahealth.com.